Good evening, everyone. I'm Maitri, your host for today's live session, and I'm delighted to welcome Dr. Sourabh Chopra, a renowned expert in the field of neurology. Today, we're going to discuss a topic that affects many of us at some point in our lives: headaches.
Thank you, Maitri, for having invited me for the session today, and welcome listeners to today's session. Today we'll be discussing on headaches.
Welcome, Dr. Chopra. Let's dive right in. Dr. Sourabh, could you start by explaining what a headache is and the different types of headaches people might experience?
Okay, so headache is a personal experience actually. So if I tell you I'm having a headache, you have to believe me. There is no other way of doctors to determine whether a particular person is having headache and how much headache they are having. So it's basically a personal experience, a feeling of pain or discomfort. There are various kinds of headaches. So there can be secondary headaches and primary headaches. Now these sound like sort of difficult terms, but they are not. So primary headaches are which almost everyone in this world experiences occasionally. So headaches that are induced by stress or induced by lack of sleep or various others day-to-day factors. Whereas secondary headaches are headaches that occur because of significant medical conditions, like people having serious brain infections or tumors, etc. will also experience headaches. Not only that, even minor problems like sinus pain and tooth and ear pain can also sometimes be misinterpreted as headaches by people. So those are secondary headaches which occur because of secondary problems, whereas primary headaches are headaches that most of us experience all the time.
Thank you for that overview. Dr. Sourabh, what are some common triggers for headaches, and how can people identify what might be causing their headaches?
Yes. So headaches, as I said, can be triggered by various day-to-day events in our lives. So if I don't get a good night's sleep, that can trigger a headache. In fact, bad sleep practices are one of the major triggers of headaches, and improving our sleep will go a long way in getting better experience and lesser headaches. Besides sleep, I would say that day-to-day stressors definitely contribute to causing headaches. So improved lifestyle is very, very important to reduce headaches. So besides sleep, one also needs to have a sort of consistent daily practice. One should be eating meals on the right time. One should not be delaying or skipping meals all the time. So one should get at least some form of physical activity daily. So it should be incorporated in our day-to-day life. It can be a proper exercise or fitness session, or it can be just taking the stairs all the time in our office, or using the elevators less and less, walking more rather than kind of picking up the phone and calling our colleague who's sitting two offices away. One can walk to them and talk to them. That will improve our physical activity, right? So having a good physical activity will reduce headaches. Not only that, small things like drinking a lot of water can also improve headaches and reduce the severity of headaches. So adequate hydration also goes a long way.
That's a great tip, Dr. Sourabh. So, once someone has identified their headache triggers, what are some strategies for managing and preventing headaches?
Okay, so I think I covered a few of them earlier, but when we have identified triggers, if we identify very, very specific triggers like food triggers, which are difficult to identify but sometimes are there, one can omit those specific food items, certain cheese, certain beverages that contain a lot of caffeine may be the triggers in a particular case. Removing them or reducing consumption of those items will also reduce headaches. Besides that, I just mentioned in my previous answer that improving sleep, better hydration, and having some form of physical activity daily goes a long way. And in nowadays, I think the most important another factor that triggers headache and can be improved is the amount of screen time one gets. So reducing the screen exposure is important, especially for children, because children are nowadays stuck with mobile devices. There are so many devices available to them in the household. Reducing exposure to mobile devices will also reduce headaches in many patients.
Can you tell us about the role of medications in managing headaches?
So there are two kinds of medications that can help managing headaches. So one is the acute medication. So if I'm having a severe headache, I want to pop a painkiller to reduce the pain or stop the pain. So painkillers or various kinds of pain medications are definitely useful for headaches, but they only give us short-term relief. Long-term medications for headaches mainly are to reduce the frequency and the severity of headaches. So there are prophylactic medications, that is medications that reduce your headaches. Those are required only and only in people who have frequent and recurrent headaches.
Thank you, Dr. Sourabh, for explaining the role of medications in managing headaches. Dr. Chopra, many times we get a headache when there is a change in eyesight. What can be done to resolve that?
So that's a good question. So sometimes headaches can be because of refractory error, that is your specs number might have changed, your eyesight might be affected, so that can also trigger a headache. So in those cases, just improving your specs number or getting your eyes checked properly with a good ophthalmologist can also improve the headaches. This is not common but can sometimes occur.
Dr. Sourabh, as a parent, we have seen headaches in our children. Can it be a sign of a tumor?
Yes, it can be, but I would say it is extremely rare. Brain tumors are not common in children, and headaches are very common in children, whereas brain tumors are not. So the moment a child complains of headache, tumor should not be the first thing that one thinks about and gets worried about, right? So the chances that your child who is having a headache would end up having a serious brain problem are low. But do get them checked, but don't get excessively worried about them.
Thank you for that explanation. What kind of pain does a person feel suffering from migraine? How can one identify it's a migraine headache?
So as far as primary headaches are concerned, there are two kinds of primary headache. One is known as the tension type headache and the other is known as the migraine headaches. So what are migraines? Migraines are basically headaches that have very specific characteristics. So migraines commonly will occur on the side of the temples or the front of the head. Migraines very rare to see them in the backside of your head, right? Many times, especially in older children and adults, migraines can be one-sided headaches. So if you have a one-sided headaches or if you have headaches that are mainly on your temples or in the front of your head and they are severe, migraine headaches can be quite severe. They can be debilitating. That is, you would rather leave all your work and want to rest. So severe headaches which are episodic, that is, they occur for a few hours, trouble you for a few hours and then completely go away. In between the headaches, you are completely fine. So those are the migraine headaches. Along with that, in migraine, sometimes one can have a lot of nausea and vomitings. Also, one can have increase in headaches with exposure to bright lights and loud sounds. So when you have these characteristics, that is, headaches that occur at specific places, headaches that can be one-sided, headaches that are increased with bright light and sound, and headaches associated with nausea and vomiting. If you have many of these characteristics, then most likely your headaches have a migraine component. Whereas if you don't have any of these specific characteristics, you have a generalized headache, which is more like an ache rather than a shooting sharp pain, then the headache is much more likely to be a tension type headache. With migraines, there are specific drugs that are more helpful, whereas in tension type headaches, there is a different set of drugs that are more helpful.
Dr. Sourabh, cervical patients also suffer from headaches. In that case, should those patients consult a neurologist or some other specialty?
Yes. So I think there's a big myth that cervical problems cause headaches. In fact, it is the other way around. So if you have a migraine or a severe headache, many times the pain not only involves the head but will also involve the upper part of your neck and sometimes all the way up to your shoulders. So one will misinterpret it as a cervical problem, although the problem is mainly a headache or a migraine. When you have isolated cervical problems, then obviously a neurosurgeon or an orthopedic surgeon would be more useful. But if the headache is almost always there with your neck pain, and especially if the headache precedes the neck pain, then it is much more likely to be a primary headache problem rather than a cervical problem.
That's insightful. Dr. Sourabh, whenever we suffer from headaches, we usually take painkillers. Can those medicines have long-term effects, and do they harm the liver, kidney, or any other organs?
Yes, that's a very good question. So medicines, all medicines, if taken without proper care, can lead to side effects. But if taken with proper care and under the supervision of doctors, one will be pre-warned about the side effects. So they are very less likely to occur. Need for painkillers every few days or multiple times a week, then you should not self-medicate. Please see a doctor, see a good neurologist who can help you with your headaches.
Dr. Sourabh, is there any alternative for medicines?
Yes, as I just mentioned, improving your lifestyle is much more effective than medications in reducing and preventing headaches.
Dr. Sourabh, are there any specific exercises that one should do to avoid headaches?
So, there are no specific exercises which will prevent headaches, but overall, if we exercise regularly, if we keep our body fit, then the chances of one getting severe and recurrent headaches will go down.
Dr. Sourabh, in pregnancy, if a woman suffers from headaches, can she consume medicines?
In pregnancy, one should be doubly cautious because pregnancy, one is not only giving the medicine to the person suffering the headache, one is also giving the medicine along with her to the developing baby inside her. So, without consulting your gynecologist, I would recommend that you should not consume any medication, because there are some medications which, although very safe for the adult, can be quite dangerous for the developing baby. So never take medications over the counter from your chemist when you are pregnant.